No matter how good today is, tomorrow can be even brighter. And that's why we're dedicating our lives to public health. My name is Dr. Siddiqa Kendi. I'm a Bloomberg Fellow based in Boston, and my work is dedicated to injury prevention and health equity, ensuring that all children have access to the human right of health and safety everywhere. The urgency I feel doing this work each day is one that I know you feel too. And it's an urgency that, for decades, has also driven the public service and philanthropy of our next speaker. He was born and raised in Massachusetts, just down the street from where I currently work. Later, he chose a school in Baltimore, and President Daniels and all of the Bloomberg Fellows are very glad that he did. Working his way through college, Mike Bloomberg graduated from Johns Hopkins University. Building on the $5 he donated to Hopkins that year, he has given generously to his alma mater ever since, both financially, but also his time and energy. The public health school was renamed for him even before he won a long shot campaign for mayor of New York City. And as mayor, Mike implemented ambitious public health programs that made him an international leader in the field. Most recently, Mike was reappointed as World Health Organization Global Ambassador for Non-Communicable Diseases and Injuries. His foundation, Bloomberg Philanthropies, continues to make major global investments in life-saving initiatives to reduce tobacco and e-cigarette use, support healthy food policy, increase road safety, which is near and dear to my heart, improve maternal health, and more. And in 2016, as part of the Public Health School Centennial, he launched the Bloomberg American Health Initiative to help train the public health workforce of tomorrow, which brings us all to today. Please join me now in welcoming the 108th Mayor of New York City, our partner in public health, and the initiative's biggest fan, Mike Bloomberg.
Thank you. Thank you. Well, good morning, everyone. What a crowd. Dr. Kendi, thank you for that kind introduction. You gave it just the way I wrote it, so thank you. And thank you, Ron, Josh, and Michelle. And it was great to see Dane McKenzie here earlier. I think it's the most appropriate way we could possibly have to start the morning with all the talent we have assembled on location here in Philadelphia. And I want to thank all of you, the followers, fellows, faculty, and staff of the Bloomberg American Health Initiative. Your work isn't always glamorous, and often it can be thankless. I know you didn't choose this field to receive fame or fortune, and if you did, sorry about that. But I do think that all of you deserve a special round of applause. Give yourself one right now. Back when I was a student at Johns Hopkins and my objective was to make the top half of the class possible, something that I certainly succeeded at, I want to thank Ron Daniels for not revealing that I was a C student, but I did study engineering, and I never thought that the public health school would someday bear my name, and I can assure you that my professors did not either. None of them are alive today, but that's what they would say. Public health has been a passion of mine for a very long time. I first caught the bug one night over dinner with your former dean, who's here today, Dr. Al Sommer, who we're glad to have on the board of Bloomberg Philanthropies. And by the time dessert arrived, Al had made me a true believer, so it was a great dinner. He couldn't have had a great career in sales. He could have had a great career in sales if public health hadn't worked out, but he's the one that convinced me and deserves the credit for all of this. Al, thank you. A few years later, when I was elected mayor of New York, I didn't need a crash course in how effective public health policy could be. Our administration took on smoking and trans fats and sugar, and we did it with science, data, and facts. And in each case, we faced strong industry opposition. But we beat them on tobacco and trans fats, and here in Philadelphia, Mayor Kenney is showing that you can beat them on sugar as well. Yes, all right. Back in 2016, Philadelphia adopted a 1.5 cents per ounce soda tax, and when the industry tried to overturn it, the mayor didn't back down, and we were with him every step of the way, and together we beat the industry, and the people of Philadelphia are winners because the tax is working. Philadelphia has seen a 35% decline in sugary drink sales since the tax was executed, which means it's already helping to save countless of lives. The mayor and the city's health commissioner, Dr. Cheryl Bettigol, have helped make Philadelphia a national leader on food policy, and we're glad to have her with us today. Nice round of applause for her. Last month, we saw another major victory for public health, this time in California. The e-cigarette industry tried to overturn that state's ban on flavored tobacco products. But people said no ways, they fought back, and I was glad to support them. And once again, the tobacco industry lost, and the public health won. And once again, it will help save millions of lives. So we're proving that it really is possible to defeat the special interests at the ballot box, because when you have the facts on your side and you communicate them clearly, most times, not always, but most times, the public will support you. And that's why we're raising awareness of your work that is crucial to your success. COVID has been the worst public health crisis the world has faced in a very long time. But we also know the pandemic only intensifies fires that have been burning for a long time. The problems that were here before the pandemic included all the non-communicable diseases that are leading causes of death, and they're still here, and they're still getting worse. Sadly, nowheres are they getting worse than right here in the United States, even though we thought all the tools we needed we had to prevent them, except, unfortunately, one: political courage. You've heard of American exceptionalism, the idea that America is unlike any other nation. Well, when it comes to communicable diseases, commitment to advancing freedom and democracy in the world, there's a truth to that idea. But there's also, sadly, a dark side of American exceptionalism, and it's staring us right in the face, even though many elected officials don't want to see it. So I thought this morning we could take a quick trip around the world, going on location, if you will, to see just how exceptional we really are and how far we have to go just to catch up with the rest of the developing world. For starters, we have a gun homicide rate 26 times higher than that of other high-income countries. 26 times. That certainly is exceptional. And the United States also accounts for more than a third of gun suicides globally. Think about that. We're about 4% of the world's population, but 35% of global gun suicides. And think about how many of those suicides are young people, and all the promise and potential our country is losing from their deaths. All of us pray that our families won't be the victims, because the fact is it could happen to any family, and every day, 119 times a day, it does. Our child and adolescent suicide rate ranks in the top half of developed countries. That's heartbreaking if you think about it. But of course, it's not just gun violence prevention and suicide prevention where we rank so low in the world. Oh no. Among peer nations, we also have the highest rate of drug overdose deaths. more than 100,000 deaths last year, an all-time high. And the bad news keeps coming. A major risk for heart disease is obesity, and the U.S. is the most obese, large, developed nation in the world. That's killing people far before their time. Add it all up, and due to a combination of these factors and more, I'm sorry to report that the United States is not at the top of the list when it comes to life expectancy in the developed world, nor do we rank in the top 10, or the top 20, or even the top 30. We are number 40. We actually trail 39 countries in life expectancy. So in the greatest and wealthiest and most powerful country in the world, we rank 40th in the area that matters most, staying alive. That is a national embarrassment, and we're all here today because we refuse to accept it, and because we know progress is possible. And we saw that in New York City. When people ask me which accomplishment I'm most proud of from my time in City Hall, I usually cite the same statistic Kelly Henning mentioned in the video. Over our 12 years in office, life expectancy in New York grew by more than 3 years, which was 2 years longer than the national average. Back then, a lot of people thought continued progress was inevitable. After all, life expectancy had been on a steady upward trajectory for decades, as you can see in this chart. But of course, progress wasn't inevitable. It never is. And when national life expectancy began to stagnate and decline for the first time in a century, I just couldn't sit back and watch it happen, especially since the federal government wasn't doing much about it. That's how this initiative was born. And we worked with a team at Hopkins to design it around a principle that has been so important to our work in New York City: collaboration and partnership across agencies and fields. Part of the genius of the Bloomberg American Health Initiative, if I may say so, is your commitment to working across disciplines, because it really does open up new avenues for change, and it yet is so rarely happens. The good news is the challenges we face are not insurmountable. After all, history of American public health is filled with extraordinary successes. Anyone who buckled a seatbelt this morning, or who ate breakfast without trans fats, or sat in a smoke-free diner, has benefited from public health initiatives, even if they don't realize it. But as we know, we are not moving fast enough. To help accelerate our progress, the Bloomberg American Health Initiative is releasing a new report today called Reversing the Decline. The document offers 10 practical steps for addressing underlying causes of the biggest contributing factors to declining life expectancy. Those 10 steps include making sure medications to treat opioid use are the standard of care in all medical settings, and enacting stronger gun safety laws, among others. I'll add one more step, because most of the other 10 won't happen without it. Call your member of Congress and other elected officials and tell them to stop protecting special interest and industries that start protecting us instead, or we're going to vote them out of office and replace them with people who will. The one thing they care about is being able to feed their families. They've got to keep their job, so getting reelected is more important than protecting you. You've got to turn that equation around and make them understand that protecting you is the ways that they're going to get elected, and if not, we're going to damn well work for whoever runs against them, no matter how good or how bad that person is. It's time for the Congress people and the senators to stand up. I'm glad to say that several of the report's authors have joined us today. They are professors at the Hopkins Bloomberg School of Public Health, and I'd like each of them to stand or raise a hand because they all deserve a round of applause. Well, thank you, professors, and all the faculty and fellows for the great work that you do every day. There are countless infants, toddlers, teens, and 20-somethings, and parents and grandparents who all owe their lives to the work that you are doing. They may not realize it, but I hope it's something you think about every day, because thanks to all of you, tomorrow is going to be better than today for millions of people. So keep up the great work, and thank you. Thank you very much.